Hello everyone, my name is Hannah Boysel and this is my presentation on the healthcare issue that was presented to me by the healthcare stakeholder I interviewed. This next slide is the healthcare stakeholder that I interviewed and what the roles of her position was. I interviewed the supervisor of the billing department at Memorial Hospital. Her name is Brittany. She is in charge of managing the professional billing and patient financial services department. She monitors reimbursement to the facility as well as what is coming into the hospital and leaving the hospital financially. Lastly, she evaluates workflows, productivity, as well as the attendance of each employee. She also aids in the training of new staff and old staff with updated systems. This is the healthcare issue that was presented to me during this interview. The healthcare issue that was presented to me was the staff shortages as well as product shortages. There was also a minor issue that was addressed during this interview that during COVID, hours had to be cut in the billing department as well as other areas within the hospital as the need for non-emergent care was not there. There was a shortage in healthcare staff pre-COVID, but after COVID happened, the shortage became more and more beginning in May of 2020. COVID caused many shortages in staff as many became ill from being in contact or many became scared of what was going on. Many also lost their jobs due to the shortage as there was not enough financial income to keep all hired if not necessary. Products were in short supply before COVID, but just like staffing, as COVID began, the more need there was for products because more in demand as hospitals like Memorial were becoming overcapacitated with patients with the virus. This next slide, I will provide a little history about staffing in the healthcare. In the early 1900s, nurses were in charge of changing and laundering linens, housekeeping duties, preparing meals, as well as ordering supplies. Many physicians cared for their patients as nurses were not trained enough to do so yet. In the mid-1900s, 8-hour days were established for nurses to work as many nurses before worked 12 or even 24 hours, which was hard on nurses to care for patients for that long without being burnt out or exhausted. By the late 1900s, nursing schools became more popular and demanding as nurses started going to school for more knowledge of how to properly care for patients. Hospitals became more in demand for qualified nurses to take on the role of patient care and helping physicians as hospitals became more popular. And finally, we talk about the present. In the present years, staffing increased as many people wanted to get in the nursing field to care for patients. Healthcare occupations were a desired job to get as many hospitals and healthcare facilities provided great benefits as well as their retirement system. Memorial Hospital, for example, has great benefits, medical, dental, and vision, as well as going by a retirement system called OPERS, O-P-E-R-S, that not many healthcare facilities have. Unfortunately, COVID hit and caused a lack of staffing in many healthcare facilities, as well as the shortages of products for these facilities. Staff shortages and product shortages due to COVID-19. The reasons for staff shortages during COVID-19 could go on forever, but here are a few reasons why there were staff shortages during this hard time. Many nurses became burnout or exhausted due to working longer hours, as well as providing nonstop care for those that came down with this what could be deadly virus. There were many hardships due to COVID that caused shortages in the healthcare staff, as many had to take time off from either contracting the virus or a family member contracted the virus and needed care. When contracting the virus, many people had to take at least 14 days off of work. Many healthcare employees became too stressed to be able to function due to this virus, causing many to quit or take time off, which in result caused a shortage of employees. Many people started receiving COVID relief funds and thought they didn't need to work as much as they were receiving these funds. There was a lack of income to the hospital, which in result caused many hospitals and healthcare facilities to cut hours of their employees or lay off some of their employees that were not needed. Memorial Hospital Billing Department cut hours down by 16 hours for each employee, and many outpatient or elective surgeries were being canceled, which in result caused many within the surgical department to be laid off or hours reduced, as there weren't many surgeries happening. Due to COVID-19, the lack of staff caused lower quality of care for patients in need, as there were many nurses jumping room to room as best as they could to take care of their patients. Staffing became a desired need when COVID began and when it started to calm down, but will always be in need. When it comes to the product shortages, there were shortages of healthcare products before COVID, but things were like needles, hubs for the needles, and other things like these. When COVID hit, gloves, gowns, and masks became more scarce than they were before because every patient and hospital staff or healthcare facility staff were required to wear masks. And then those in direct or close contact with a COVID-19 patient was required to wear a gown, gloves, and mask when around each patient. And in between each patient, they were required to strip all of these items and then put new on when entering a new patient's room, and etc. There was, in result, not enough being produced compared to the amount that was being used, which caused the shortage in many things. So now on to the iron triangle model and the relationships between costs, quality, and access when it comes to the staff shortages or product shortages. When it comes to costs, the training of nurses becomes more costly as for other healthcare employees due to the shortage of staffing. There isn't as much income coming into the hospital because they can only accept as many patients as to the ratio of nurses or staffing available. The need to keep those experienced employees becomes more expensive as they demand raises or more time off to go by their terms. When the cost of care is reduced, then the more patients that will receive needed care. As for quality, when the quality of care goes up, the access could decrease as the need for supplies become more in demand. Due to COVID, the need for supplies were in demand, but many healthcare facilities were not able to get many supplies, so the quality of care decreased due to not having the necessary supplies to care for each patient. On the other hand, the better the care for patients, the better the quality outcomes there are for those patients as well. And lastly, access. The better the quality, the more likely patients will come back to obtain services like these again. The more access for care to patients in need, the better quality of care as well as cost efficient the healthcare facilities become. If there was adequate staffing and enough products, access would increase and healthcare facilities would go back to where they were either several months to several years ago, where they were at their best. Next is conditions related to staff shortages and product shortages. The first condition is equal to fair compensation. In other words, for those employees that have been working extra or have been with the healthcare facility way before and throughout COVID, they should be compensated in some way as they have worked very hard for this company. The compensation could be something as little as a day paid off, paid time off, or a bonus check. As for increasing efficiency, this is another great condition, as the more efficient a healthcare facility is, the more likely people would want to find a position within that organization. For example, if there was a staff shortage at a hospital and the efficiency of that facility was poor, it is more likely that the staff will start looking elsewhere for improvement. And the same goes to the amount of products one healthcare facility has or can get at that time. Lastly is retention. Engaging with employees allows those higher up in the company to speak with employees about what they think has worked or hasn't worked in the organization, as well as how the healthcare facility could keep their experienced employees and try to find other potential employees to work there. At times, offering a flexible work schedule on certain days is something that helps keep employees staffed at an organization. And this is the end. Thank you so much for listening.